shockwave therapy device, electromagnetic type. Uh, this is the clinical model you can see, horizontal one, and this is the applicator of the device. This is the head attachment you can see, and these are the various head attachment you will get with the same. You will get around 7 attachment with the same. You can see this is the convex one, and this is the concave. This is the convex one. This is the concave one, and like this there are 7 different head attachment. So now I will give you the demo of the device. Before the same, I will tell you what is the difference between electromagnetic and pneumatic one. So if you say you take that probe or applicator, there is a bullet inside the same. That bullet travels from one end to another and strike and generate the shock wave. So that shock wave is used in the therapeutic purpose. So if the travel of the bullet is because of the electromagnetic field around the bullet, that device is called electromagnetic shock wave. And if the bullet travels because of some force from the behind like air compression, that device called pneumatic or air compression based shock wave therapy. So this is the electromagnetic one where the electromagnetic field is there and the bullet travels from one end to another. So I will give you the demo of the device also. Now I will start the same from the back side. You can see this is the touch screen device and this is a clinical model. When I start the same Biotronix here International, we are importing the same Dr. Shopko model. And when I touch the screen, you will ask for the password. The default password is, I repeat, 00000 6 times 0. So you can modify the same also, and that password you will share with the person whom you authorize for using the device. So you can modify the same also, you can put the default 0 0 0 0 0 0. As soon as I put 6 times 0 the default password, I will enter to the main interface. So you can see elbow, knee, shoulder, hip, AD, pubic, hand, lumbar, foot, fat condition. So there are 10 treatment protocol, 10 treatment area, out of which 8 are for the physiotherapy purpose, 1 is for the ED, erectile dysfunction, and 1 for the fat condition. So if someone wants for the ED purpose, that device, all the physiotherapy shock waves that comes with the ED and physiotherapy. So if someone wants to use the same for the ED, that person can select the ED program. But there is no device which is just for the ED purpose. So that device you can discard that physiotherapy program. You can use the ED one. And if physiotherapists want to use that, physiotherapists can use 8 joints and discard the ED and FAN. So if someone wants to use the both for the physiotherapy and ED, that person can use that device. So now I will show you the demo of the device by selecting one of the program. Like if I selected the elbow program. So in the elbow, you can see the interface. This is the elbow section. You can see, and 2 and 3. This is in the yellow color. Please select second and third and. So the one in the yellow color is the recommended one, and the other, the white, are not recommended. However, you can use the same, but these are the recommended one for the joint you have selected. And there are also recommendation shocks per 2000 to 2500 shocks you can provide for the elbow area, and session 5 to 10 and interval 5 to 10 days. So these are the recommendation. So if you are not aware about how much shots, how much something like this, the recommendation is there. And if you want to change the same according to the patient condition, patient structure, and patient joint, and doctor interpretation, so you can vary the same also. You can vary the frequency from 1 Hz to 16 Hz. You can see 1 Hz to 16 Hz, and you can vary the energy also from 5 millijoule to 200 millijoule. These are the recommendations. Like if I select the elbow, the recommendations are there, the handpiece recommendation is there, and these are the preset. Like number of shots are recommended over here, and frequency is 3, which is recommended, energy is 20 millijoule, which is recommended. You can use the same as it is, you can vary the same. You can vary the same frequency 1 to 16 Hz, you can see, and if I make the same to 1, you can go energy from minimum 5 millijoule to 200 millijoule. But in case if you select the frequency 1 to up to 50, not the maximum one, you can go energy up to 200. Like if I select 8, I can go up to 200. But if I select 15, 16, because these are the last two frequencies, 15, 16, 14, 13, 12, 10, 9. So below 10, you can go up to 200, you can see millijoule, and if you increase the same, that will automatically adjust the maximum level of energy. You can see in the 15 you can't go more than 30 millijoule. So as you increase the frequency, the energy supplied, if you select the maximum one which is 200, that may damage the joint. So according to the same, if you increase the intense frequency to some maximum level, it will automatically increase, adjust the maximum level of the energy. So like this, if I go to the hip, the frequency here is 8 Hertz and I can go up to 200. You can see frequency I am increasing 9, 10, and if I go, I can go up to 10. If I go to the frequency 12, if I go 14, 15, you can see it is automatically varying the maximum limit. I can go beyond the same because 15 frequency is too much, and in that frequency the energy maximum you can take 130, because if you want to go beyond the same, that may damage the product also and that may damage the joint also. So by this way the same is automatically adjusted, and you can select the other programs also that like the ED. If the frequency is 1, you can go up to energy 25, 30 millijoule is quite enough for the ED. I will show you the demo how effective 30 millijoule or 5 millijoule and 200 millijoule is. And you can see if I increase the frequency 3, 4, 5, 6, 7, 8, 10, I can go up to 10 Hertz in the ED, because this is the recommended. You can't go beyond the same, and the maximum energy over here is 30 millijoule. So in the ED, we can go up to 1 to 10 Hertz, and energy is 5 to 30 millijoule, and the recommended handpiece is this. So now I will show you the demo of the same. You can see frequency I have selected 3, energy I will select the minimum, and these are the number of selected shots. I can increase the same up to 5,000. So when I select the 5,000, I will start the treatment. The same will keep on counting, and once the same reach 5,000, it will automatically stop the treatment. Or you can stop the same in between by pressing this button, as well as in the handpiece. Like you can see, you can press this, and the same will stop in between when the patient will feel discomfort or some area might slip off. You can stop the same in between. If you the doctor want to stop the treatment in between, he can press the switch. So now I will show you the demo of the same. I have pressed the same. Now the device applicator is ready to work. You can see as the bullet is traveling, it is generating heat because it is striking. So to cool off the same, there is a fan below the same, behind the same, and you can see that fan has got started because I am ready to provide the treatment. So I put the same on the elbow. I press the switch. You can see this is the 3 Hertz frequency. Now first I show you 1 Hertz. You can see this is 1 Hertz and the minimum intensity 5 millijoule. So this is quite enough for me. I'm getting the impact on my hand. So I'm stopping the same. I'm moving the frequency to a little bit more, like 3. You can see this is the 4 Hertz. So I'm getting quite great effect on the 4 Hertz. So that is why, like, going to the maximum frequency, you have the limit in the energy section, because 5 millijoule is the minimum limit over here, and which is I am feeling quite enough energy in the field. So if I select the maximum frequency and then the limit is like 200 in case the joint is like elbow or some smaller joint, that may damage the joint. So that is why the limit is set in the higher frequency. And this is the 60 hertz, you can see. So you can see 60 hertz. And this is the 5 millisecond. So I'm getting quite great impact on my hand. If I want to increase the energy, I will decrease the frequency to the medium range, and now I will increase the energy to 25. I can put some value over here so that there will be no friction to make the movement. So this is 25 millijoule only. So you can think 200 millijoule is quite enough. So can't be used on the smaller joint, that can be used on the hip, that can be used on the bigger joint, the joint with the fatty tissue area. So and now you can see I have used the same. The shots I am getting is getting counted. So I have selected 2650 shots for the treatment, and currently I have got 276 shots. So frequency is 1 hertz. It will slowly give me the shots like I have shown you, and it will keep on counting. If I increase the frequency, like if I getting 10 as frequency 10 shots, then it will keep on counting like this. So this is the demo of the device, and if I select some other, like if I select hip, pre-selected shots are there, recommendation are there, pre-selected shot, and frequency over here is 8. So recommended one is the 8. You can use the lower, you can use the higher also, and energy over 110. But if I increase the frequency to like 16, the maximum energy I can go 100, not 200. If I want to use in the 200, I need to decrease the frequency, and then I can increase up to 200. So that is how quite intelligent that device is to prevent the damage of the joint or any kind of injury. And once you start the same, like if I start the same, and I will decrease the energy. Because I am not taking the same on that joint, I am taking on the hand and all. So that is what you can see. I am working for the energy, you can see the sound. And if I want to stop in between the frame, I can press that button. So you can see 79 shots are there. But if I select the frequency to minimum, like 1, I am getting shots slower and slower. You can see 1 by 1 it is getting increased. So this was the demo of the device. I switched the same off, and you can use 8 programs of physiotherapy, 1 for the ED, and ED I have already shown the limit is there up to 5 to 30 millijoule, because 30 millijoule for ED is quite enough, quite good. Now this is the device imported by Biotronix here International LLP, and we are the importer of the same, and this is the metallic body you can see, not the fiber body which is available in the market like a cheaper model and all. This is the metallic body, quite stable and premium look, and you can see these are the various applicators, and there are 7 different types of heads, and these are the covers to absorb the shock. If you want to use the same like metallic part, the same can be used, or the same can be used with the cover. And this is the key, because there is a bullet in the same. So once the bullet keep on using after a particular some time, depends on the shots you have taken, the patient you are treating. Once the bullet get consumed up, because of friction, the bullet side keep on decreasing, and once the same will be consumed up, the same has to be opened using that key. and then you can replace the bullet, and bullet can be purchased from us, and then you can use the device again. So this is the demo of the device. Hope I have explained everything. If you still have any question or query, the same comes in the box. You can see this is the box. So this is the box. This is the box of the same. So this is quite stable box, so you can put the same and you can transport the same, or if you want to tap the same to place to some area, you can use this. So the device is placed over here and all the accessories over here. So this was the demo of the device, and if you want to purchase the same, you can contact our number provided. Our sales team will contact you and share all the details. You can comment your contact number or WhatsApp number in the comment section, or you can call us, or you can visit our website to purchase it. Thank you for watching.